My name's Nimalie Stone. I'm an epidemiologist. I work at the Centers for Disease Control and Prevention within the Division of Healthcare Quality Promotion. And my focus area is infection prevention, surveillance, and antibiotic stewardship in long-term care settings. And primarily, we focus on nursing home providers because they currently are the largest group of healthcare providers where acute and more medically complex patients are starting to enter, and that's a result of hospital lengths of stay shortening and frail and older adults needing perhaps a transition point between the hospital and their home in the community, and nursing homes are more increasingly taking on that role of providing rehabilitation and skilled nursing services. So what we're seeing happen is a shift in the complexity of the population out of hospitals into these other healthcare environments. And we recognized at CDC that we needed to have more focused resources, educational materials, and messages for these providers. So I think when we think about the term nursing home, most of us call into mind a residential care environment where we have older adults or frail, perhaps cognitively impaired individuals who require a safe environment to live, perhaps with assistance on their activities of daily living. And that traditional long stay population still certainly receives a lot of care in these facilities. And that's going to likely grow as the aging population continues to grow in this country. However, there's been a change in the other opportunities for healthcare delivery. So nursing homes several years ago started to accept a group called short stay post-acute care residents. And these are individuals who have recently been hospitalized, are discharged from the hospital, but continue to require a certain level of skilled nursing support and a certain level of rehabilitation. And perhaps they need anywhere from 2 to 3 months to fully recover and be ready to move back into their homes in the community. And it's this population of short stay residents which receive payment through the Medicare Part A payment structure offered an avenue for a different type of resident to come in. Now, not somebody who's intending to reside permanently in these facilities, but actually somebody who's only transitional, and they're ultimately meant to be discharged back into a different environment for their primary residence. So that population of short stay residents is really increasing in nursing homes, partly because of the reimbursement levels being somewhat higher, but also because the shift in long stay care has moved more toward assisted living and toward community-based care environments, that people are staying in their homes longer. Most of us would prefer, I think, to stay in our own home as opposed to being in a facility. And so as community-based supports are increasing for long stay or long-term social and non-medical care, the opportunity for nursing homes to fill the gap in that short stay, more acute care is growing. So what we're seeing as this shift is happening is nursing homes of today look much more like hospitals looked 10 or 15 years ago. So antibiotic stewardship is, reaching all of our colleagues and all of our professional providers in every arena, whether it's outpatient, emergency departments, nursing homes, and the attendings that practice in long-term care settings, as well as hospitals. The implementation of stewardship, you're right, absolutely changes depending on the care environment in which you work. In nursing homes, CDC just developed and released last month some guidance and resources for how antibiotic stewardship activities could be implemented in nursing homes. And we took the previously reported core elements of antibiotic stewardship for hospitals that were released in 2014 and adapted them for nursing homes. The elements like leadership accountability, leadership commitment and accountability, having antibiotic expertise, and taking actions to change prescribing policy and practices, those are all fundamentally the same. However, the approach to doing that in a nursing home environment does look a little different. You don't have infectious disease supports and pharmacists readily available, for example, like we might see in a hospital.